Well, men's sexual health is rarely seen on the forefront of healthcare and especially innovation. My name is Nico, and my passion for change in this area is what drives my participation here today. Peyronie's disease presents clinically as a painful bend caused by plaque formation on the male penis. This condition impairs daily functions such as reproductive health, urination, and it's also linked to high rates of depression. More common than you might think, Peyronie's disease affects 13% of the male population over 50. That means nearly 26 million people fall into this category in North America alone. Until recently, surgical removal of the plaque was the only form of treatment, but due to the invasiveness of the operation, only 1% of those affected would seek treatment. Fortunately, an injectable solution to dissolve the plaque has been created and is being used to treat many more with the condition. But because the plaque is small, firm, and moves easily, clinicians often miss the injection target site or push the plaque away, damaging surrounding tissue and wasting medication. Might not seem like too big a deal, but with a price tag of $1,400 per injection and an average treatment course of 8 sessions, injection efficacy is a must. To address these complications, I've invented a localized traction device that secures the plaque using a sensitive floating lock vise and increases injection accuracy through ultrasound needle guidance. The system improves plaque accessibility and injection accuracy as measured by a decrease in curvature and physician confidence. Components for the device can be 3D printed or created using a plastic injection system. Given the 100% mechanical construct of the device, scaled manufacturing at a price point of only $9 per unit is possible and promotes global device usage. To ensure a strong clinical and market potential for the device, I prioritize an end-user focus throughout the design process by incorporating first-hand clinical experience and exposure with Peyronie's treatment complications, and ongoing guidance from 15 of the 16 Peyronie specialists across our nation. Of clinical value in this innovation, it supports a standardized non-surgical treatment method for Peyronie's with improved treatment cost and improved outcomes. Of market value, as injection therapy gains traction among urologic surgeons and Peyronie's patients, there awaits an untapped market with 26 million potential users and no competitors. Thank you very much for your attention.
Thanks, Nico. Yeah, you were right. Those are some really innovative slides.
Thank you.
Questions from the judges. As they're probably typing in. Meredith Powell, she's going to start us off. Why do you think there are no competitors addressing this issue?
I think that what it boils down to is really someone's got to do the dirty work when it comes to this system. Also, the injection platform for treatment is quite new as a whole. As I mentioned, surgery before was done for tens of years. But then when this solution came out, it's a collagenase solution that breaks down the plaque. And this was only invented maybe 3 to 4 years ago. So this whole injection method for a treatment for Peyronie's is undiscovered, really. And that's why no one's really capitalized on the opportunity to make a device to make the injection more efficacious.
Interesting. Rick Sellers asks, what sort of feedback have you had from the medical field?
From the medical field, I've spoken with, again, 15 out of the 16 Peyronie's disease specialists across Canada. I've worked firsthand with Dr. Ryan Flanagan now for 6 months. He's a clinical urologist at Vancouver General Hospital. I've seen multiple Peyronie's disease treatment procedures. I've talked with patients, and I've also discussed the qualms that we're trying to address here by designing a device. I especially employed that end user focus to make sure that we're going to design a device here that will make it effectively into clinic and also effectively treat the patients and their needs scenario.
Interesting. I did notice, just waiting for some more questions, but I did notice at the beginning you sort of had a few what looked like quotes, perhaps from some of the people. Were those actual patients that you had spoken with?
Yes, yeah, those are from literature as well as patients that that I've heard from in the clinic saying what their thoughts were on the condition as a whole. Of course, it's something that not many people come forward with talking about men's sexual health, and that's one of the main reasons I'm bringing it forward here, because these conditions are uncomfortable, they're limiting, they're quite embarrassing, and men, due to societal constructs, don't feel like bringing this issue forward in the clinic, and that is of importance.
Right. Wendy Hurlbert asks, with this procedure, how does the recovery time experience compare to current practices?
Current practices being a surgical practice or the injection versus the surgery?
We'll start with the surgery practice.
Okay, so in terms of the injection versus the surgery, the surgical recovery times are that of maybe 6 to 8 weeks or so, similar to that of like a broken arm you'd expect. And injections, it is much less invasive. So you see a lot less inflammation after an injection. You'll go home and have a little bit of bruising for a day or so, but then you'll come back maybe every 2 weeks for 8 different sessions. So it's a bit, it's less significant during the operation, but maybe a longer time to get a treatment. But patients desire the injection as a result of it being so much less invasive and having a much less long-term effect that would hinder their progress towards a more healthy state.
Wonderful. Thanks, Nico. I think we're going to end it there. Thank you so much. Great job.
Thank you very much.
Yeah, thanks, Nico. We're going to